Hi, my name's Chloe.
My name's Morgan.
My name's Ben.
And today we're going to be doing a video on the head-to-toe assessment, which we're going to be doing the oropharynx, the abdomen, and the fecal and urinary system. So we're going to be showing the correct ways to doing that type of assessment and then the wrong ways too.
And today I'm going to be the patient.
I'll be the nurse.
And we're just going to show you guys how it's done.
Let's begin.
So first, to start the head-to-toe assessment, the nurse is going to walk in and he will introduce himself to the patient.
Hi, my name is Ben. The nurse today.
Verify her identity and date of birth.
Tell me your name.
Morgan Henry.
Date of birth.
4/24/2000.
Perfect.
Provide patient privacy. And gather all the appropriate equipment that's needed. And next, the nurse is going to do hand hygiene, proper hand hygiene, so hand sanitizer and then gloves before doing any of the assessments. Okay, and then so to start off, we're going to start with the oropharynx first. So the nurse is going to look at the patient's lips, inspect the color, symmetry, make sure there's no signs of any cracking.
No signs of cracking. They're symmetrical. They're pink. They're moist.
Good. And now after that, the patient or the nurse is going to inspect the patient's teeth and buccal mucosa by pulling down her bottom lip. No.
Oh!
The nurse.
I'm sorry.
The nurse must wear gloves while touching the patient's mouth before doing that. The nurse is going to correctly look at the patient's teeth and buccal mucosa.
Mind if I do that to you? Thank you. They're pink. They're moist. There's no lesions or scarring.
How the teeth look.
You open your mouth up for me. Teeth are nice and white. They're pearly. There's no signs of gingivitis also.
Good. So after that, the nurse will remove his gloves. He will perform hand hygiene. Now the nurse is going to inspect the patient's tongue range of motion by asking her to move her tongue all
Move your tongue
around,
around. Thank you.
which means the cranial nerve 12 is intact. And after that, the nurse will inspect the patient's uvula by asking her to say ah as her mouth is
Can
open,
you say ah?
which means that cranial nerve 9 is intact. And then the nurse will inspect the patient's oral membranes, noting that they're pink, moist, and intact with the pen light.
You open up. Pink, moist, and intact.
Good. And then lastly, for the for assessing the mouth, the nurse will also assess the patient's ability to swallow,
Can you swallow for me? Thank you.
which means the cranial nerve 10 is intact. So after assessing the patient's mouth for the head to toe, we will move on to the assessment of the abdomen. So to begin this, the nurse will ask the patient to get into the supine position.
Oh. Can you lie on your back for me? Thanks.
The nurse will make sure that there's a pillow to support the patient and to not stress out her abdomen muscles. And then the nurse will also ask the patient if it is okay to expose her abdomen.
So can I expose your abdomen?
We will act like the patient's abdomen is exposed for this because normally it would be. So first, what the nurse is going to do is he's going to inspect the patient's abdomen. So he's going to note its color,
It's uniform.
its size, which he would verbalize that he is going to measure it at the level of the umbilicus.
I would measure at the level of the umbilicus.
He's going to note if any edema is present,
There's no edema present.
and he is going to note if there is a vascular pattern present.
There's no vascular pattern present.
The nurse will also note any striae, scars, or lesions present on her abdomen.
There's no striae, scars, or lesions present.
He will note the contour and symmetry. So we will note if it is symmetric, flat, rounded, any of that.
Abdomen is flat and rounded.
And then lastly, he will also note that the client's abdomen moves in symmetry with her breaths.
Abdomen moves symmetrically with breaths.
Okay, and then after assessing the abdomen, he will also assess her umbilicus. So he will note the color,
Color is uniform.
the location,
Midline.
and then he will also note the contour, which we raise flat, convex.
It's flat.
Okay. So now the nurse is going to auscultate, percuss, and palpate the patient's abdomen starting in the right lower quadrant. No. The nurse needs to auscultate the patient's bowel sounds first so that during percussion or palpation, no sounds get distorted in the process. So the nurse is going to want to auscultate the patient's bowel sounds before percussing or palpating, beginning in the right lower quadrant. Okay, so the nurse is going to listen in each quadrant for a full minute. If bowel sounds were to be absent, he would listen for a full 5 minutes in each before noting that no bowel sounds were present. And the bowel sounds often are normal active, which means they're occurring every 5 to 10 seconds. They have a low pitch, and they will be audible and loud when auscultating them. After auscultation, the patient or the nurse is going to percuss all 4 quadrants. Percussion usually resonates over gas-filled bowels, and areas of dullness would be over the liver, spleen, or a full bladder if the patient were to have one, and percussion also resonates over the stomach as well. And then lastly, after percussion, the nurse is going to palpate the patient's abdomen, starting with light palpations. No. The nurse must wear gloves before palpating the patient's stomach. Before palpating the patient's stomach, the nurse will ask about any tenderness or pain that is present in their abdomen.
Do you have any pain or tenderness I should know about?
I have some pain, my upper.
Up there?
No. When palpating the abdomen, if the patient has any areas of pain, that area will be palpated lastly.
Any pain or tenderness so far? Just up top.
So he palpated the least tender areas first, and then he would move on to the top to where it is most tender for the patient. So the nurse did light palpations, and then he would also do deep palpations as well. And then once those are done, that would conclude the abdomen assessment for the head to toe. And the nurse would discard gloves and perform hand hygiene. Lastly, after doing the abdomen assessment, we will move on to the fecal and urination part of it. So the nurse will ask how the client's appetite is.
How's your appetite, by the way?
I eat several times, or not several, but a couple times a day.
Okay, that's good.
And then he will also ask if the client has had any recent changes in her appetite.
Any recent changes in your appetite?
Not that I know.
Next, the nurse will ask the patient about her last bowel movements.
You pooped today?
No, that is not the proper way to ask the patient about her bowel movements. You should word it saying, when was your last bowel movement?
Okay. When was the last BM?
Last night.
And then the nurse will also ask about the color and the consistency of the bowel movement.
How was the color? Was it like brown or like?
Yeah, it's brown, it's consistent.
Okay, consistent. Okay.
And then the nurse will also ask the patient if she has had any recent issues with diarrhea or constipation.
Have you had any recent issues with diarrhea or constipation?
No.
And then lastly, the nurse will ask about any changes in the patient's bowel function.
Are there any changes in your bowel function?
No.
Okay.
Moving on to urinary, the nurse will ask about the patient's daily intake of fluids.
How's your intake of fluids?
I drink a lot of water.
And in regard to her intake of fluids, he will also ask about her output.
Is your output also okay?
Yeah, I pee a couple times a day.
Okay. Beautiful.
Now the nurse will ask about the patient's amount of urine as well as its color.
How much urine is coming out? Is it a lot? Is it not a lot?
It's consistent, it's yellow.
Yellow.
And then going along with this, he will also ask if she ever has any odor, pain, or burning when she urinates.
Any odor, pain, or burning sensations?
I've noticed some pain and odor when I urinate.
So, got a UTI.
No. When the patient gives you certain symptoms during the assessment, you will not make assumptions because this is just an assessment and you do not want to startle the patient by telling her she has something that she may not have.
Sorry.
Okay, so next you will ask the patient if she has any recent changes in her urine pattern.
Do you have any recent changes in your urine pattern I should know about?
Not that I've noticed.
Okay.
And lastly, you will also ask the client if she has any drainage coming from any orifice.
Do you have any drainage coming from any orifices?
Mm-mm.
Okay, so this concludes the head to toe assessment for the mouth, abdomen, fecal, and urinary systems. It concludes the right way how to do it, as long as some of the wrong ways that someone might assess these.
Thank you.
Thank you.
Thank you.
Peace out.
Don't say that.
Cut that out.
Okay.
I just had some urinating.
Just like when you see me, just be like, this guy's got. Just think of that. Maybe